Hi everyone, this is Neel Raithatha, consultant audiologist and director of WAXscope. I would like to start off by wishing you all a happy new year, and I hope you all also had a wonderful Christmas if you were celebrating. And this is my first upload for 2025, and it's of a patient who attended with a blocked right ear, and we're just using the WAXscope here with the medium size specular. So this patient last attended 4 years ago, and so I've definitely advised them to attend a bit more regularly. So this wax, it's blocking the ear right from the entrance. So we're just past the first bend there. We can see the first bend just to the left-hand side of this specular, all the way to the eardrum. And there's a lot of skin adhesions, which was making it difficult to pull away because this skin, as you can see here, it's not only enveloping the wax plug, but it was still adhered to the canal wall. So that's that slither of skin that you just saw me remove from the base of the plug, and there's a bit onto the right hand side. And a bit deeper in the ear, the wax was a bit more soft and sticky, which also makes it hard to suction. So we used medical grade olive oil spray on a couple of occasions at the beginning just to loosen these skin adhesions, and also when we are removing the more medial, so the latter half of this wax plug, to change the consistency to make it easier to get a suction grip. When the wax is really, really soft and mushy, sometimes it can occlude, it can block the suction probe. So the oil not only helps to somewhat coagulate the wax, making it into a bit more of a firmer plug, but it also lubricates the ear canal wall and the inside of the suction tip, preventing or minimizing the risk of blockages. So I'm just giving it a little wriggle and a little pull. This patient did have a couple of really long strands of hair at the entrance, and you may just see one of them. It's a bit blurry because we're focusing a bit deeper in the ear, but it's just right in the middle of the screen. I only noticed that now that I'm watching it back. So we're just going to stretch the ear open. It's going to work on the top part of this wax plug now. So this plug's just beyond the second bend, and I'm getting a suction grip, giving it a little wriggle. And as I'm wriggling it, what we're trying to do is detach it from the canal walls. We're trying to mobilize it. And as I'm wriggling it, I'm also just trying to bring it forwards at the same time. And then I'm also rocking it up and down. That's another way of trying to detach it from the canal wall. So I'm just stretching open the ear. So the entrance of the ear was quite narrow, actually. So the WAXscope helped to stretch open the first bend. I'm just refocusing because this wax is a bit deeper in the ear. It's probably in the latter third now. Again, you've got this slither of skin that I'm suctioning. And as I'm suctioning the skin, some of the wax is also coming away with it. So the wax is attached. As I said, this skin is enveloping the wax plug. So we just brought it to the second bend. And then there's the first bend, just to the left where you see all the hairs. So it got trapped here. So this region of the ear canal is the narrowest section. We call it the isthmus. Well, there's actually two isthmuses in the ear, where we are now, in between the first and second bend. So you can see the first bend to the left where the hairs are protruding outwards, and the second bend to the right where that fleshy skin is. So I've just gone back in. I'm stretching that first bend open a bit more. I'm just dilating the ear canal, I'm distending it so we can bring this wax through. You can see here it's a bit more mushy and slushy. So it's a bit harder to get a suction grip. It's just blocking the tube. So I think I'm going to use a little bit more oil. And as it's going up the tube, it's blocking it. So the suction power is getting reduced. And there we are. It's just blocked the tube there. So I think I've just put just a squirt of oil. I've not put too much in. I'm just stretching open that first bend. And then I'm giving it a little wriggle again. I'm bringing it outwards. As I'm bringing it out, I'm also navigating the curvature of the ear canal. So although the speculum, by stretching open the ear, it does somewhat straighten the ear canal, it doesn't fully. So we want to maneuver it around the second bend, which is to the right, and then past the first bend to the left. So we're having to meander this wax out as we extract it. So again, this is where I put the oil in, sorry. And it's just helped to bind the wax plug. It's lubricating the inside of the suction probe, so it's not getting us blocked frequently. Get this is, I think this section of the wax was actually visible via the naked eye, so half of it was protruding out of the ear canal, a bit of it's just broken away. So I think this is the last section. But it's quite sticky, it's smeared itself out. There's a bit more, actually a bit deeper. So this ear was very generous to us. The wax just kept coming. And there's that final plug, I believe. No, so it just separated. So every time I think we've done the procedure, there's a bit more wax. You can tell there's quite a lot in there. So I think we're going to stretch open the ear canal. We're going to get the eardrum in focus. There we are, that's the hammer bone. We can see all the blood capillaries supplying the blood to the hammer bone. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.